So British Columbia bringing back masks, but they're not calling them or not calling it a mandate. So how's this going to work, do you think?
I don't know. It's hard to predict how some people are going to take news like this, and the ambiguous nature of the wording might cause a bit of confusion as well.
Do you think that other provinces will follow suit? You're in Ontario. Do you expect Ontario to do the same?
I don't know. I really hope they do. I'm fortunate that I've been working in an emergency department that never did actually drop its mask mandate. And I think that was a smart move. I think, there's extremely vulnerable people coming into our hospitals, obviously. And in a healthcare setting, there should be every expectation that all the protections that we can afford our patients should be brought forward.
Do masks work? I know there's still some debate over that, doctor.
There's no credible debate that masks don't work. Certainly, there's no evidence whatsoever that they actually hurt anybody. Good quality masks, especially N95s that are well fitted, are exceptionally helpful. I've been in the middle of this pandemic since it started, and I have never contracted COVID through work, and that includes before vaccinations were available.
So, what are you seeing right now in the ER? There are a lot of sort of anecdotes out there about how many people are sick with COVID right now. What are you seeing in the hospital?
Oh, we're definitely seeing a surge. I've heard some jurisdictions, their admissions, which are a lagging indicator, are up between 10 and 20%. Our test positivity has risen sharply in our department. And personally, I've had two people in my personal life come down with COVID for the first time during the whole pandemic, just in the last week.
For the first time. So, what do you recommend people do to protect themselves against the virus?
Well, anytime you're certainly in a crowded area, especially indoors, really do wear a mask. If you haven't had a booster shot against COVID in the last year, I'd suggest a booster. If you're medically vulnerable, i.e., like you're over the age of 60, you're on immunosuppressant medications, you got multiple comorbidities, I'd suggest you even look to get a booster shot every 6 months.
Doctor, thanks so much for being with us. Dr. Steve Flindall is an ER doctor.